The last 24 months have been tumultuous and unsettling. We've navigated the front lines of an unprecedented public health crisis. We've been subject to rounds of unfair legislation. As we hold the hands of dying patients in overcrowded ICUs, our salaries are capped, our support systems cut, our rights denied. And while the Ford government calls us frontline heroes,
if it was up to me, I'd just give them the bank.
We experience a focused, deliberate erosion of equity, fairness, and respect. In 2019, the Ford government tables Bill 124, capping wage increases at 1%. The wage suppression legislation excludes firefighters and most police services, but takes direct aim at registered nurses and healthcare professionals. ONA immediately files a charter challenge, but the damage is done. The legislation fuels more nursing shortages, PTSD, and burnout. This untenable disrespect from the Ford government forces nurses to leave the province in droves. For ONA members, Bill 124 is a symbol to continue our strong advocacy for frontline healthcare in Ontario. By early 2020, outbreaks of the COVID-19 virus are sweeping the globe. With over 100,000 cases reported, a pandemic is declared. Here in Ontario, healthcare providers quickly face a critical shortage of PPE, gloves, gowns, N95 respirators. It seems many workplaces are keeping precious PPE under lock and key. ONA launches a legal challenge in response, and the ruling is quick. Sadly, Ontario's healthcare system is already overwhelmed. There are devastating consequences for nurses and healthcare professionals, but the impact of COVID-19 on vulnerable populations is profound. Thousands die in the first few months, more than 3,800 in long-term care facilities alone. Chronic government inaction and a failure to recognize COVID-19 as airborne takes a deadly toll. As the first wave eases in July, the Ford government positions itself for another extraordinary power grab. Bill 195 extends sweeping emergency powers, diluting health and safety measures and overriding collective agreements. It's a devastating blow to workers' rights. Today, 20 months into the pandemic, we're holding our ground against a stubborn virus, standing up to unfair legislation, and speaking out against a breaking healthcare system. Despite unprecedented times, ONA members continue to provide the quality care our patients expect and deserve. Their everyday actions in the last 24 months are both heartening and inspiring. Hundreds of members take to social media. We post selfies demanding repeal of Bill 124. We engage the media, meet with MPPs, organize rallies, and raise our voices.
Patient safety, number one!
We send tens of thousands of emails to government denouncing unfair legislation and policy. We stage phone zaps and virtual rallies to engage our members and fuel advocacy against RN layoffs, chronic understaffing, and harmful changes to models of care. Our collective goal? Withdraw unfair legislation, ensure safe workplaces, and put patients, residents, and clients first. Despite pandemic challenges, our commitment to member services is relentless. After a 15-year battle, RNs working in female-dominated professions in long-term care finally win the right to pay equity with male comparators. Despite a government appeal, the Supreme Court sides with ONA. It's an important victory that ensures all our members are recognized and valued as they should. On other fronts, we continue to focus resources to fight unsafe conditions, workplace inequity, racism, and harassment. We've established programs that connect nurses to mental health and substance abuse treatment. We've won IACs to build support for better patient care. We've launched a wide range of tools, reporting guides, and violence prevention toolkits. And as deadly variants continue to emerge and neighboring provinces battle large-scale outbreaks, we are prepared and ready for what comes next. Stay safe, stay strong, and stay focused. The fight isn't over.